My name is Emma, and this is my partner Tania. Today we are going to be discussing the diabetes and its effect on oral hygiene care. Diabetes is the most common endocrine disorder in the U.S. and affects 34.2 million people. In the last 2 decades, diabetes has nearly doubled in people. And currently it is the 7th leading cause of death in the U.S. Studies have shown the differences between well-controlled and uncontrolled diabetic patients, and uncontrolled glycemic patients have more oral complications. This graph right here shows by the CDC that in 2004, there were 6.9% of people that were diagnosed with diabetes. In 2016, it nearly tripled to 33%.
In addition, there is an increased risk of periodontitis in patients with diabetes of about 34 to 68%. The risk for alveolar bone loss is about 11 times higher in patients with uncontrolled diabetes. Because of this increased prevalence of diabetes, it is important for dental hygienists to become more familiar with the disease. The purpose of this presentation is to educate dental hygienists about the proper oral hygiene care of patients with diabetes.
Diabetes is an abnormal syndrome of carb, fat, and protein metabolism, which can cause acute and chronic complications. There are 3 types of diabetes. Type 1, which is an absolute insulin deficiency, where a patient needs daily administration of insulin. Type 2, which is the body's ineffective use of insulin. And type 3, which is gestational diabetes, is when a pregnant lady has an abnormal glucose tolerance for insulin.
Diabetes can affect people of all ages. About 1/3 of the adults in the U.S. are undiagnosed with diabetes, and the diagnosis of diabetes is made upon the systemic and oral signs and symptoms of the disease. And this picture over here on the left shows that every 1 in 12 people have diabetes, and 1 life is lost every 7 seconds from diabetes. And also about 77% of people with diabetes live in low and middle income countries.
Diabetes is an incurable disease, but it can be managed by dental hygienists, dentists, doctors, and other healthcare professionals. There are 4 therapeutic ways to manage diabetes.
Those 4 therapeutic goals are to normalize blood glucose levels, typically have an A1C level of around 7%, to maintain or minimize acute complications such as diabetic ketoacidosis and hypoglycemia, to maintain an ideal body weight of about 18.5 to 24.9 BMI, and also to minimize or manage chronic complications such as cataracts, gangrene, periodontal disease, and coronary heart disease.
Oral health is an important role for nutritional and systemic well-being. It is critical to manage diabetes because it does have likelihood of oral complications. One of the main oral complications is periodontal disease, which is the 6th complication of diabetes.
The systemic infection and inflammation caused from periodontal disease can have an adverse effect on proper glycemic control, so it is important to maintain a comprehensive care team for the patient with diabetes. In addition, patients with poor glycemic control can have an increased incidence of periodontal disease, dental caries, pulp necrosis, and periapical abscesses.
Oral signs and symptoms of a diabetic patient include gingivitis, periodontitis, dental caries, and salivary dysfunction. Severe periodontitis is associated with uncontrolled glycemic control and high A1C levels. Some studies show that glycemic control can be managed through non-surgical periodontal therapy.
Patients with diabetes have an impaired leukocyte function, reduced chemotaxis, and impaired wound repair healing. And about 1/3 of these patients have diminished taste perception. Xerostomia is a common complaint among these patients, and if left untreated, xerostomia can cause inflamed tissues, caries, and the inability to maintain stable glycemic controls. In addition, uncontrolled glycemic control can also inhibit the recovery of the bone.
Overall, it is important to understand how diabetes diabetes can affect oral, nutritional, and overall systemic well-being. Dental professionals should be giving diabetic patients periodontal screenings every time they come in, and also recommend regular dental care visits because diabetes does affect their dental care needs. It is also important to educate patients about the oral systemic leak because it is the biggest step to prevent oral and systemic complications.